Hi, I'm Dr. Sharbell Hashoul, and today let's talk about a term that can sound scary on a mammogram report: architectural distortion. If you've seen those words on your results and felt your stomach drop, take a breath. I want to walk you through exactly what it means and why it's not automatically bad news. Let's start with the basics. A mammogram is an X-ray picture of the breast, and normal breast tissue has a certain pattern to it. Think of it like the natural grain in a piece of wood, with fat, glands, and connective tissue arranged in a fairly recognizable way. Architectural distortion simply means that in one area this normal pattern looks pulled, twisted, or disrupted, without an obvious lump or mass being seen. Instead of the tissue flowing in its usual pattern, it looks like something is tugging at it from a central point, almost like spokes pulling inward toward the center of a wheel. Here's the important part. Architectural distortion is a description of an appearance, not a diagnosis. It tells your radiologist that something in the tissue pattern looks different from what's expected, and it deserves a closer look. It does not tell us by itself whether that something is serious or completely harmless. So, what actually causes this kind of pattern? There are several possibilities, and many of them are benign, meaning not cancer. One common cause is a previous surgery or biopsy in that area. Scar tissue can absolutely create a distortion pattern on a mammogram, sometimes for years afterward. Another benign cause is something called a radial scar or complex sclerosing lesion, which is a benign growth of tissue that can mimic distortion. Trauma to the breast or even normal variations in fibrous tissue can also produce this look. On the other hand, architectural distortion can sometimes be an early sign of breast cancer, particularly a type called invasive lobular carcinoma, which doesn't always form a clear round lump and can instead show up as this kind of subtle pulling pattern. This is exactly why radiologists take architectural distortion seriously and rarely leave it unexplained. Because the cause can't be determined from the mammogram picture alone, the next step is almost always additional imaging. This might include extra mammogram views taken from different angles, called spot compression views, and often a breast ultrasound to look at the area in more detail. In many cases, especially when there's no clear benign explanation, like a prior surgery, a biopsy is recommended. A biopsy simply means a small, minimally invasive sample of tissue is taken from that specific spot and looked at under a microscope by a pathologist, who can then say definitively what the tissue actually is. I want to be clear that needing a biopsy for architectural distortion does not mean cancer is likely. Many biopsies done for this exact finding come back as benign, showing scar tissue, a radial scar, or normal fibrous changes. The biopsy is simply the tool that gives a clear, confident answer instead of an educated guess. Here's the one practical takeaway I want you to leave with. If your mammogram report mentions architectural distortion, the appropriate next step is further imaging or a tissue sample, not panic. This finding is taken seriously precisely because it's not fully explainable by imaging alone, and getting a clear answer through additional views or a biopsy is how your care team makes sure nothing is missed, while also often reassuring patients that the finding is benign. As always, this video is meant to help you understand the language of your reports a little better, not to interpret your specific results. Please talk with your own doctor or radiologist about what architectural distortion means in your particular case and what the recommended next steps are for you. Thanks for watching and take care of yourself.